Also following live remarks from Governor Kemp, who you see on the left-hand side of your screen. He is speaking now about COVID and vaccinations. Let's listen to the governor.
Haven't gotten the vaccination yet. They'll take the time, either use that Friday to schedule their appointment. Perhaps it will encourage them to do it before that Friday so they can have a long weekend. And if they don't decide to do it, then they can come back to work. But I want them to think about doing it to protect themselves and their family and to help our folks in the hospitals out.
Governor, on the added staff for hospitals, will that be under the same existing contract that the state has been performing throughout the pandemic?
Yeah, well, we're going to be extending
company?
the contract. I mean, I can let Kaylee speak to that if you want to hear more details about that. We are dealing with the market that's out there with other states, so we're addressing that issue as well. So I feel very confident, and she did as well. We actually just spoke about this right before we came out, that we're going to be able to be successful to start ramping up. It'll take us obviously a little while hiring that many people, but even a little relief in our hospitals right now is very helpful. Because you also got to realize there's a lot of healthcare professionals that have gotten COVID, or either they're not able to work because of exposures, which is hurting them as well. Not to mention the just normal volume. Before we went into this COVID surge that we're seeing, hospitals were extremely busy even before this started, basically back at full tilt because people had put off medical procedures that I'm sure you all will remember we warned against last year when things were shut down and people literally were scared to go to the hospital even when they needed urgent care.
Good afternoon, Governor.
Good afternoon.
As far as schools are concerned, we're seeing full grade levels shutting down, going back home. Some school systems started with thousands of cases to begin with. Are you reconsidering your guidance to schools or maybe toughening the restriction there? Can you speak on schools and COVID right now?
Well, what I'm doing with schools right now is supporting the superintendents and the principals and all the educators to make good decisions at the local level. This same thing in some regards happened last year. Students came back, teachers came back, some of them came back having COVID, not knowing it. A lot of schools had to deal with an initial surge and kind of fight through that, and every school is going to have to deal with that differently. I'm trusting them to do that. I don't think any more guidance or any restrictions. I actually think that would be counterproductive. I had a first grade teacher that told me this week on a visit to a school, please do not shut our schools back down. Kids that didn't go to pre-K last year, they are struggling in the first grade classroom because they're not used to being in that environment, and that is why we need to get our kids back. I visited 3 schools, including one this morning on the way in the last week or 10 days, one in Cherokee County, one in Wayne County, and then one in Oconee County on the way out of town this morning. And I'm very confident that they know how to deal with any issues. If they need to go virtual for a week or 2 weeks or delay as some systems are doing, I'm certainly supportive of that. But we also have systems that this is going to be their 3rd full week of instruction, and they're doing just fine, very few issues, and they're plowing ahead. And that is why I think the best approach is a local one. They did this all last year. Most systems got a full 180 days in, and like our daughter's school last year, I mean, they had times where they had to leave the 9th and the 11th grade at home and bring the 10th and 12th grade back for a week just to deal with the situation, but the next week they had everybody back in. And I think letting the schools deal with that individual situation that they have is better than a one-size-fits-all, overarching policy from the state or the federal government, I might add.